Loneliness is a pervasive emotional state characterized by feelings of social isolation, disconnectedness, and a lack of meaningful connections with others. While loneliness is often perceived as a transient emotion, chronic loneliness can have profound effects on both mental and physical health. Understanding the causes and health consequences of loneliness is essential for addressing this widespread issue effectively. Here's an exploration of loneliness, including its causes and health implications. 1. Causes of loneliness. Social isolation, physical separation from friends, family, or social networks due to factors such as geographic distance, mobility limitations, or lack of social opportunities can contribute to loneliness. Transitions and life changes. Major life transitions such as relocation, retirement, divorce, bereavement, or changes in social roles and relationships can disrupt social connections and increase feelings of loneliness. Relationship difficulties. Conflict, estrangement, or breakdowns in relationships with family members, friends, or romantic partners can contribute to feelings of loneliness and alienation. Psychological factors. Underlying mental health conditions such as depression, anxiety, low self-esteem, or social anxiety disorder can exacerbate feelings of loneliness and isolation. Number 2. Health consequences of loneliness. Mental health effects. Chronic loneliness is associated with an increased risk of depression, anxiety, stress, and other mood disorders, as well as higher rates of suicidal ideation and behavior. Physical health effects. Loneliness is linked to a range of adverse physical health outcomes, including cardiovascular disease, hypertension, compromised immune function, inflammation, obesity, and impaired sleep quality. Cognitive decline. Long-term loneliness may accelerate cognitive decline and increase the risk of developing neurodegenerative conditions such as Alzheimer's disease and dementia. Mortality risk. Studies have found that chronic loneliness is associated with a significantly higher risk of premature mortality, comparable to the risks associated with smoking and obesity. 3. Interventions and support. Building social connections, engaging in social activities, joining clubs or community groups, volunteering, and fostering new relationships can help combat loneliness and enhance social support networks. Seeking professional help. Individuals experiencing chronic loneliness or associated mental health issues should seek support from mental health professionals, counselors, or therapists who can provide interventions such as cognitive behavioral therapy, CBT, or supportive counseling. Utilizing technology. Virtual platforms, social media, online communities, and telecommunication tools can facilitate connections and provide opportunities for social interaction, especially for individuals with limited mobility or geographic isolation. Promoting community initiatives. Community-based programs, outreach efforts, and initiatives aimed at reducing social isolation, fostering inclusivity, and strengthening social connections can play a vital role in addressing loneliness at a broader societal level. Loneliness is a multifaceted issue with far-reaching implications for mental, physical, and cognitive health. By recognizing the causes and understanding the health consequences of loneliness, individuals, communities, and policymakers can work together to implement interventions and support systems that promote social connectedness, resilience, and well-being.